came out of the COVID era and what we learned from that, and how we need to more and more look after our staff. And this is, with £3 million, this is what we built for it.
Steve, what else do you protect? Very nice to see you.
NHS Charities Together.
Yeah, so this was an old building, about the same age as the one you visited last time, but it's got a checkered history, hasn't it?
Yeah, so the building, 1878, because it was quite near to where on the governors of the hospital, Royal Berkshire Hospital, that was then the school, running school, and he was kind of on. But the building then went.
It's been 3 years since you built, is it?
Yeah, it's being built,
Yes.
you just started.
Yes, yeah, that's right.
Have you noticed a difference in the workforce in terms of being able to access this? Felt like they're valued and that we look more at?
You know, actually some of the things that we've kind of learned through that COVID experience is just how important it is to look after the community since then. But those demands have continued. So having an environment where you can kind of support staff with...
£62 million.
Yes,
Right.
Peter.
And thank you for your support, by the way, yours and the Princess of Wales, from NHS Charities Together. The context is we're now 5 years on from the start of COVID. The first death. We've tried to ensure that the money goes into areas that is slightly to one side of what you would expect public funding to go into.
To manage to get all around the UK.
Yeah.
And interestingly, what have you identified around the UK, certain hotspots or certain areas which maybe haven't been supported as well in the past, and actually your support has been a huge amount?
Yeah, our supporters has tried to reach
Most of the staff. Have you noticed that big change in all that now, or is it still certain areas we need to work better at?
Let me take in, and I think we have a cup of tea available for you if you would like one. But
where should I sit here? Very handy your badges.
So would you like a cup of tea?
Actually, I'm alright at the moment.
Sure.
Yeah, fine. Good. Who have we got here? Who's...
Staff Wellbeing. My expertise in Hatha Yoga, and which includes the physical movements, and we highlighted the importance of lungs and overall resilience. So,
And are you based in this building? Do you see only for NHS workforce? And how regularly are you seeing your patients, which are workforce? Can we say the right words there? But are you getting more and more sort of referrals and more people coming to see you?
people are seeing the benefits and people are referring each other, and we always keep on doing the marketing. So yeah, and its classes are like 3 to 4 times a week.
Yeah.
So mainly in the evenings, but
in the class or the last time, that's where people relax and talk, and you just talk. What is the mood like amongst
the same class and tailored like that. So and I can see few are coming back to the few of my students are here. So.
It's a good point. Exercise probably is quite a hard thing for everyone to get in their day, but when the hours are on runs, that actually being able to come here and do Pilates, yoga is probably quite a sort of a big part of that plus for their day. Yeah, okay. And Sabi, you do?
So there on the day, but Vini's very good with kind of checking in with students and what kind of yoga are they wanting. Just helping us to work through techniques like regulating the nervous system, etc. So that really helps.
Other parts of the NHS workforce that you don't normally see. You probably see legal every day.
Absolutely.
And actually, when you're in yoga, you might meet somebody from all parts. It's really important that top down, everyone gets to mingle, talk, chat, and see how things are going. And how important for you though is this been? You all talk about it. Has this been a bit of a sort of lifesaver almost for many of you for the last few years?
Yeah, absolutely, it really has. And I think, as I say, it's that detox that you need. And I'm one of the health and wellbeing champions as well for my team. Let's switch off and then recharge our battery, so to speak. So, and it's worked wonders.
Drills and things like that. You've got to keep doing for training.
Not really in terms of qualifications, but Matt will, I'm sure, go into more details. But Matt hosts the session, so it's very much about attending, being briefed in terms of what's happening around the trust, around the centre, etc. Taking home some really good health and wellbeing messages back to your teams, delivering them locally, sharing the incentives that we have around the trust.
And presumably also it helps your antennae, if you like, be a bit more alert to what's happening around you.
Absolutely.
You can spot people who may be having a bit of a difficult time, which is quite crucial because you become the sort of you're the front line of identifying where some of the issues might be.
Yeah, and it's so easy to get lost in your day-to-day work. You forget kind of the health and wellbeing element. So this is an opportunity to just step back and say, actually, you know, how are my team doing? How are people around me doing? So just having this has been amazing.
Matt, do I take it then yours to do with mental health side of things?
Yeah, good morning, sir. It's a privilege to have you here. My name's Matt. I'm the Staff Health and Wellbeing Lead. So I joined in the middle of COVID in response to coordinate, oversee, manage, try and develop our staff health and wellbeing offering, of which this building has very quickly become that flagship sort of project. And as an organisation, we've grown. Each year there's an NHS staff survey, and we're really proud in the last few years and hoping to be so again with the upcoming results from the previous survey that we're one of the leading acute NHS trusts for supporting staff health. So Rushka, who sat next to me, is dedicated mental health, and I'm sure Rushka will tell you more in a moment. My role was across the breadth of staff health and wellbeing, so physical health, mental health, financial wellbeing as well, and being the key topics. Yeah. Some of my projects have been developing staff health checks, so we've seen now nearly 2,000 of our staff that have come through for a preventative cardiovascular metabolic disease. From a mental health perspective, that I know you're very interested on and developed, and that's a peer-led support service that focuses on the impact of a traumatic cardiac rehabilitation. If we know we do early CPR, then that can help with physical outcomes. With the TRIM service, the trauma support service, it's about early support for that mental health and supporting staff on the impact an event has had on them.
Yeah. So the reason why I asked that question was just how far back can we go in terms of when mental health was valued, if you like, by organisations that may not have seen it before? Because it's quite an interesting point as if we go back. I mean, everyone knows COVID now is, you know, one of those moments we all look back on and go, God, how did we all get through that? Particularly NHS. I mean, you guys, obviously, it doesn't need saying how difficult it was for you, but it's quite interesting to work out how far back mental health suddenly became, you know, a key role that everyone values being a part of it. Do you, in terms of the trauma side of things, have we learnt certain processes and new procedures after COVID as to how we identify, how we deal with certain issues, problems, time off for people?
Yeah, definitely for me, I think it's been rewriting that narrative around working in the NHS being tough, and not many jobs you come to, hopefully, where you go to work and you traumatic cases and people dying, that actually that can still have an impact. Yeah. And that's okay, and it's okay to talk about that and reach out for the support.
The thing that you two will say more than anyone else is the fact that everyone in the NHS is there to care for others. So the last person who gets looked after is the individual. And I've seen that when I work with, you know, doctors, nurses, everyone, paramedics. They always put it down the line. And it's fine because they don't want to put someone else, their workload on someone else either. So how do you go around identifying the right people? Because for me, looking into the nation's mental health, if you like, over the last few years, is that unless there's almost a problem over and again,
Thank you. Yeah, thank you. Lovely to meet you.
Hand you that.
I'm Dr. Rich Walton. I'm a clinical psychologist and I lead on the staff psychological support service. So very much thinking about that and thinking very much about compassion, and it not just being about from self to others, but also how we receive compassion. We're not compassionate to others, it just means that we're important too, and that's a lot of the work that I do with staff, is really sort of talk about that yet, or have dealt with that in different ways, because we all have different ways of coping and managing.
It's so important as well.
Yes, absolutely.
Not just for patients, but also for you guys to get out in fresh air and see some greenery. It's really important.
Yeah.
So how were you here in COVID?
Yes, I was here in COVID. We treated the first patient that had COVID in the hospital, and yeah, I mean it's really difficult to think about that. It's been 5 years already. A lot of things have happened. I remember doing some swabs to patients back in the end of February in 2020 with not knowing a lot around that.